The city of Vienna, in the spring of 1847, was considered the medical capital of the world. The Vienna General Hospital, the Allgemeines Krankenhaus, was the largest and most advanced medical institution on the European continent. Thousands of patients passed through its wards every year. Hundreds of doctors trained within its walls. It was a place of science, of progress, of certainty. And inside one of its most important divisions, the first obstetrical clinic, women were dying at a rate that no one could explain. Not quietly. Not peacefully. They died screaming. Burning with fever. Their abdomens swollen and rigid. Some within 24 hours of giving birth. Some within 48. The condition had a name: puerperal fever. Childbed fever. Historical records from the Vienna General Hospital show that between 1841 and 1846, the mortality rate in the first obstetrical clinic reached as high as 10 to 16% in certain months. In some weeks, nearly 1 in 5 women admitted to that ward did not leave alive. The women knew it. They begged not to be admitted. Surviving accounts describe patients weeping at the entrance, pleading with staff, dropping to their knees in the street rather than enter the first clinic. Some preferred to give birth in the gutters of Vienna. Some did exactly that, and survived. The doctors inside that building had no answer. They blamed the air. They blamed the weather. They blamed the women themselves, their constitution, their fear, their moral failing. But one man refused to accept those answers. His name was Ignaz Philipp Semmelweis, and what he discovered would save millions of lives, and destroy his own. To understand what Semmelweis was up against, you first have to understand what medicine believed in 1847. There were no germs. Not yet, not officially. Germ theory, as a formal scientific framework, would not be confirmed until Louis Pasteur's experiments in the 1860s. In 1847, the dominant medical explanation for disease was miasma, the idea that illness was carried through the air, generated by rotting organic matter, foul smells, and atmospheric conditions. If patients got sick, it was the miasma. If they died, it was the miasma, or the patient's own weakness. Doctors of that era operated in conditions that today would be considered unthinkable. They moved directly from performing autopsies on cadavers to examining pregnant patients. They did not wash their hands between procedures. They considered it unnecessary. Some considered it an insult to their professional dignity. In the Vienna General Hospital, the first obstetrical clinic was staffed by medical students and doctors, many of whom spent their mornings in the morgue, dissecting bodies, studying pathological anatomy, and then proceeded directly to the maternity ward to assist with deliveries. The second obstetrical clinic, located in the same hospital, was staffed primarily by midwives, women who performed no autopsies, no dissections, no work with cadavers. Historical records from the hospital clearly document what happened as a result. In the years between 1841 and 1846, the mortality rate in the first clinic, the doctor's clinic, averaged 10.4%. In the second clinic, the midwives' clinic, it averaged 3.9%. The numbers were in plain sight. Recorded. Filed. Available to anyone who cared to look. No one had connected them. No one, yet, except Semmelweis. Ignaz Semmelweis was born in Buda, Hungary, in 1818. He had studied medicine at the University of Vienna, one of the finest medical schools in Europe, and by 1846 he had been appointed as an assistant in the first obstetrical clinic, the very ward with the catastrophic death toll. He was 28 years old. He was methodical, driven, and increasingly obsessed with a single question: why are women dying here and not there? He studied everything: the ventilation, the overcrowding, the time of day, the position of delivery, the season of the year. Every variable that official medicine suggested might be relevant. None of it explained the gap. Then, in March 1847, something happened that reoriented everything. A colleague and close friend of Semmelweis, a pathologist named Jacob Kolechka, was performing a routine cadaver examination when a student accidentally pricked Kolechka's finger with a scalpel. The wound seemed minor. Kolechka developed a fever within days. His condition deteriorated rapidly. He died. When Semmelweis read the autopsy report, he went very still. The pathological findings in Kolechka's body were nearly identical to the findings in women who had died of puerperal fever. The same inflammation. The same lesions. The same progression. Historical accounts suggest Semmelweis spent days, possibly weeks, working through the implications. If a doctor could die from a wound contaminated during an autopsy, and those findings matched the women dying in the maternity ward, then perhaps something was being carried from the cadavers to the patients. Not air. Not miasma. Something on the hands. He called it cadaverous particles, cadaverischen Stoff in German. Invisible matter transferred from the dead to the living, from the examining hand to the open tissue of a woman in labor. The solution, by his reasoning, was straightforward: eliminate the particles before touching the patients. In May 1847, Semmelweis introduced a new protocol in the first obstetrical clinic. All medical students and doctors were required to wash their hands in a solution of chlorinated lime, calcium hypochlorite, before examining any patient. The results came quickly. The mortality rate in the first clinic dropped from 10.4% to 1.27% within months. Women stopped dying. The discovery had been made. What came next was something Semmelweis could not have prepared for. The data was unambiguous. Month after month, through the second half of 1847 and into 1848, the mortality records of the first obstetrical clinic told the same story. When doctors washed their hands in chlorinated lime solution before entering the ward, women lived. When compliance slipped, mortality crept upward again. Semmelweis kept meticulous records. He compiled tables. He tracked individual cases. He noted the wards, the practitioners, the timing. In one particularly devastating stretch, November 1847, the first clinic recorded 0 deaths from childbed fever. 0. In a ward that had been killing women by the dozen every month for years. He also extended his analysis beyond Vienna. Looking at published hospital records from across Europe, Semmelweis found consistent patterns. Institutions where students conducted autopsies had higher maternal mortality rates than institutions where they did not. The data from Dublin, Paris, and Prague aligned with what he had observed in Vienna. He presented his findings to colleagues. He spoke at medical conferences. He wrote detailed letters to leading obstetricians across Europe. The response, from the most powerful voices in the medical establishment, was almost uniformly dismissive. The professor of obstetrics at Vienna, Johann Klein, Semmelweis's own department head, was particularly hostile. According to historical accounts, Klein found the hand-washing hypothesis offensive. It implied, after all, that doctors were the ones killing their patients. That the very act of medical examination, performed by educated men of science, could be the vehicle of death. That was not a conclusion the medical establishment of 1847 was prepared to accept. There was also a technical problem. Semmelweis had no mechanism. He could describe what was happening: cadaverous particles being transferred, something unseen moving from the dead to the living, but he could not explain why. He had no microscope, no bacterial culture, no germ theory. He had the numbers. The numbers, it turned out, were not enough. By 1848, Europe was in political chaos. The revolutionary uprisings that swept the continent, the spring of nations, disrupted institutions, careers, and scientific discourse alike. Vienna was no exception. In March 1848, street fighting broke out across the city. The political environment shifted violently. Careers were made and broken by allegiances and associations that had nothing to do with science. In this atmosphere, Semmelweis's contract at the Vienna General Hospital was not renewed. The official reason, as recorded in administrative documents, was administrative. Some historians believe the non-renewal was connected to his professional friction with Klein, and possibly to his political associations during the uprising. Whatever the reason, by 1850, Semmelweis had left Vienna and returned to Budapest. There, he took a position at St. Rochus Hospital and introduced his hand-washing protocol. The results, again, were immediate. Mortality rates collapsed. But his ideas were still being rejected across Europe. The letters continued to arrive, and to be dismissed. One of the most prominent obstetricians in Germany, Karl Eduard Scanzoni, publicly ridiculed Semmelweis's claims. Charles Meigs, a leading American obstetrician, famously declared that a gentleman's hands could not possibly be the source of disease. The greatest blow came from one of the few men with the intellectual standing to champion his cause, Karl Braun, who had access to the Vienna records and chose instead to publish a paper suggesting 30 other possible causes of puerperal fever, none of which was hand contamination. Semmelweis wrote back. His letters grew longer, more urgent, more personal. According to surviving correspondence, some of those letters were not read. Some were acknowledged with polite indifference. Some were answered with contempt. He was right. He could prove it. He had the data. And the wall held. The years in Budapest were, by some accounts, productive. Semmelweis worked. He taught. He continued to accumulate evidence. He eventually published his major work, The Etiology, Concept, and Prophylaxis of Childbed Fever, in 1861. The book was long, dense, repetitive, filled with tables, charts, and meticulous case records. It was also, in places, furious. Historical analysis of the text notes that Semmelweis grew increasingly unable to separate scientific argument from personal outrage. Sections of the book read less like a medical treatise and more like an indictment. He named his opponents. He accused them. He called those who refused to implement hand-washing protocols murderers, men who knowingly allowed women to die to preserve their own professional comfort and institutional pride. He was not wrong. He was also making himself impossible to defend. The medical establishment, already skeptical of a man whose hypothesis threatened its own dignity, now had a new reason to dismiss him. He was emotional, unstable, unscientific in his rhetoric. The rejection deepened. The isolation grew. Surviving letters from the early 1860s show a man who was sleeping poorly, writing obsessively, and withdrawing from professional and personal relationships. His behavior at medical gatherings became erratic. According to contemporary accounts, he would interrupt proceedings, make accusations publicly, and react with disproportionate anger to routine disagreements. His wife, Maria Weidenhofer, whom he had married in 1857, watched this change with growing alarm. By the summer of 1865, those closest to him agreed that something had broken. The exact nature of what happened next, whether it was a deliberate plan, an act of desperation, or something else entirely, remains one of the most painful questions in the. On July 30, 1865, Ignaz Semmelweis was taken to a private mental institution, the Lower Austrian Mental Institution, on the outskirts of Vienna. He was 47 years old. The circumstances of his commitment remain historically contested. Some accounts suggest he was taken there under deception, led to believe he was visiting a colleague or attending a professional engagement. Others suggest his deteriorating mental state made some form of institutional care genuinely necessary by that point. What is not contested is what happened next. Semmelweis died on August 13, 1865, just 14 days after his admission. He was 47 years old. The official cause of death, listed in surviving records, was septicemia, blood poisoning. Historical examination of those records, conducted by scholars in the 20th century, revealed something almost unbearable in its symmetry. The wounds found on Semmelweis's body at the time of his death were consistent with having been beaten, possibly by asylum guards during a physical restraint, which was a common and legally accepted practice in psychiatric institutions of that era. Those wounds became infected. The man who had discovered that infection could be prevented by cleaning the hands, the man who had watched women die from exactly this mechanism and had spent nearly 2 decades trying to stop it, died of an infected wound, in an asylum, surrounded by the very negligence he had given his life to expose. He was buried in Vienna. The funeral was small. Few came. Louis Pasteur was building his germ theory. Joseph Lister was developing antiseptic surgery. The revolution in microbiology was already beginning. It was too late for Semmelweis. Within a decade of Semmelweis's death, the scientific foundation he had been screaming toward was in place. Louis Pasteur confirmed germ theory through his famous experiments in the 1860s. Joseph Lister, building on Pasteur's work, introduced antiseptic surgical technique in 1867, just 2 years after Semmelweis died. Lister's methods spread rapidly and were credited, within years, with saving tens of thousands of surgical patients. Lister, to his credit, acknowledged Semmelweis explicitly. He understood what had happened. The medical establishment took longer. It was not until the late 19th century that the broader scientific community formally accepted that Semmelweis had been right, that hand contamination was the primary vector of puerperal fever, that the chlorinated lime solution had worked, and that the years of institutional resistance had cost an incalculable number of lives. Historians have attempted to estimate how many women died of childbed fever in Europe and North America between 1847, when Semmelweis made his discovery, and the 1880s, when antiseptic practice became widespread. The figures, drawn from hospital mortality records of the period, suggest the number runs into the hundreds of thousands. Hundreds of thousands of women who did not have to die. Today, Ignaz Semmelweis is remembered as a foundational figure in the history of medicine. His name is on hospitals, medical schools, and public health institutions across Europe. The Semmelweis reflex, the automatic rejection of new information that contradicts established belief, is named in his honor, and studied in the psychology of science and institutional resistance. His portrait hangs in medical halls. His book is cited in histories of epidemiology and infection control. And in every operating room, in every hospital, in every clinical setting on earth, the first thing a practitioner does before touching a patient is clean their hands. A ritual so ordinary that almost no one thinks about where it came from, or what it cost.